my dear friends, welcome to a new video. Today I will explain tetany. Tetany is a condition due to hypocalcemia. What is this hypocalcemia? Low number of calcium in our body is considered as hypocalcemia. So before moving in detail about hypocalcemia and tetany, let me just discuss what is this calcium. So what is this calcium? Calcium is an essential mineral in our body, and the calcium is divided into two: ionized calcium and non-ionized calcium. Another parayam, calcium is divided into two: ionized calcium and non-ionized calcium. Okay, so our body calcium, majority calcium, 99% of calcium is found in the bone, and this particular calcium is helping the bone to be strong. Okay, upon calcium in the bone is helping for strengthen the bone and teeth. Fine. So majority of calcium, that is almost 99% of our body calcium is found over the bone, and 1% is found over the cell, and 0.1% is found over the extracellular fluid. Okay. So, this extracellular fluid calcium, we divide calcium which is bound with the albumin or plasma, calcium is bound with the organic and non-organic iron, and free calcium. Total calcium 99% calcium bone, 1% of calcium in cell, and 0.1% is found over the extracellular fluid. This extracellular fluid calcium, very amount of calcium, but though that is very small amount, it can be divided into again three: albumin, which is the calcium which is bound with albumin or plasma, calcium which is bound with organic and non-organic ions, and free calcium. And this particular free calcium is considered as ionized calcium. So, free calcium, this calcium extracellular fluid 0.1% 1 point of calcium, free calcium, and that calcium is considered as ionized calcium. This ionized calcium, non-ionized calcium difference is non-ionized calcium is commonly found over the bone. That is a function. This bone calcium bone strengthen. But very small amount free calcium responsible for muscle contraction, blood coagulation, nerve conduction. Okay, very amount free ionized calcium is necessary for muscle contraction, blood coagulation, and nerve conduction. Muscles in the contraction help coagulatory factor number 4 attack and nerve conduction or impulse transmission. So these are the functions of free calcium. Okay, very amount of free calcium. Free calcium is chargeable ionized calcium, and that is necessary for all these main functions. So you can just remember 3 C's. Okay, our calcium level in our blood that need to be maintained. It is very important. So, our body calcium level normalize. Our body calcium suppose calcium body hormone stimulated. So, if hormone is stimulated, body will produce parathormone. What is this hormone? Yes, parathormone is a hormone by parathyroid gland. Okay, that is necessary for calcium and phosphorus metabolism. Okay, so this parathormone will stimulate and it gives a signal to the bone to release calcium from the bone. Okay, so parathormone stimulated our parathormone bone a signal to release calcium into the blood. When calcium level comes down. Okay, കാൽസ്യത്തിന്റെ അളവ് കുറയുമ്പോൾ പാരാതോർമോൺ സ്റ്റിമുലേറ്റഡ് ആവുന്നു and it gives a signal to the bone to release calcium from the bone to the blood. Okay, so that is how the calcium is balanced. Okay, ഇങ്ങനെ കണ്ടിന്യൂസ് ആയിട്ട് നടന്നു കഴിയുമ്പോൾ കാൽസ്യത്തിന്റെ അളവ് കൂടും. So when the calcium level increases, what happens? ഇത് പാരാതോർമോണിന്റെ ആക്ഷൻ വരുന്നത് കാൽസ്യം കുറയുമ്പോഴാണ്. Okay, next we will see what happens when calcium decreases. Okay, so calcium increases. Calcium increased ആയാൽ എന്താ സംഭവിക്കുന്നത്? It releases calcitonin. Calcitonin is a hormone by thyroid gland. Okay, so it releases calcitonin. Again, this particular calcitonin will also stimulate the bone to stop releasing calcium. Okay, calciumത്തിന്റെ അളവ് കൂടുമ്പോൾ calcitonin പ്രൊഡ്യൂസ് ചെയ്യുകയും അത് ബോണിന് ഒരു സിഗ്നൽ കൊടുക്കും to stop release of calcium. Okay, ഈ ഒരു മെത്തേഡിലാണ് നോർമൽ നമ്മുടെ ബ്ലഡിലെ കാൽസ്യത്തെ ബാലൻസ് ചെയ്യുന്നത്. ഓക്കെ, സോ മനസ്സിലായോ? ബ്ലഡിലെ കാൽസ്യത്തെ രണ്ടായിട്ട് ഡിവൈഡ് ചെയ്യുവാണ്. അയണൈസ്ഡ് കാൽസ്യം, നോൺ അയണൈസ്ഡ് കാൽസ്യം. ആൻഡ് നോൺ അയണൈസ്ഡ് കാൽസ്യം is found over the bone, and ionized calcium it is considered as a free calcium, and that is mainly responsible for muscle contraction, nerve conduction and blood coagulation. Clear? So coming to the point, it is again tetany. So tetany is a condition due to hypocalcemia. Decreased blood calcium level causes tetany. So what is the sign of tetany? Tetany is characterized by numbness, tingling sensation in the extremities, weakness of the extremities, laryngospasm, breathing difficulty and bronchospasm. Laryngospasm, bronchospasm ഉണ്ടാവുന്നത് വഴി breathing difficulty ഉണ്ടാവുകയും and it causes respiratory complication. Okay, so എന്തുകൊണ്ടാണ് ഈ laryngospasm, breathing difficulty, respiratory complications ഉണ്ടാവുന്നത്? Because calcium level കുറയുമ്പോൾ what happens? ഈ conduction, nerve conduction impaired ആവുന്നു and it causes decreased muscular contraction or the muscle strength reduced down, and ultimately that causes spasm. Okay, so the spasm causes respiratory failure and even that will affect the heart, cardiac muscles. Okay, so tetany, or it is considered as like a overt tetany which causes respiratory complications as well as other vital organ complications. So it is like a lethal condition. You have to give more attention to tetany. Okay, so main classical signs of hypocalcemia are CATS. So you can just remember CATS. What is CATS? C stands for convulsion, A stands for arrhythmia, and T stands for tetany, what we were explaining. And S stands for stridor or spasm. I repeat, convulsion, arrhythmia, tetany and stridor and spasm. Hypocalcemia തിരിച്ചറിയാനായിട്ട് ഒരു ഫിസിക്കൽ എക്സാമിനേഷൻ മെത്തേഡ് ഉണ്ട്. യൂഷ്വലി എങ്ങനെയാണ് ഹൈപ്പോകാൽസിമിയ തിരിച്ചറിയുന്നത്? യു ഹാവ് ടു ഗെറ്റ് ഡീറ്റെയിൽഡ് ഹിസ്റ്ററി ഫ്രം ദ പേഷ്യൻറ്റ്. അപ്പാർട്ട് ഫ്രം ദാറ്റ്, physical examination is also very important. So physical examination la rendu main signs aanu nammal check cheyyunnathu. One is Schwarzschild sign and second is Trousseau sign. Clear? How do we perform this Schwarzschild sign? You have to ask the patient to sit in a chair and then just stimulate the facial nerve. When you stimulate the facial nerve, it causes muscle twitching. When you stimulate the facial nerve, it causes twitching of facial muscle. Okay, so when you just closely observe the patient's face, you will be able to identify this. Okay, if that shows there is a muscle twitching, it is indicating that the patient has hypocalcemia and Schwarzschild sign shows positive. And how do we perform Trousseau sign? You have to just inflate the BP curve on a hand and check the hands, and the finger will start to twitch or carpal spasm will happen. Okay, so BP cuff vechittu kaila inflate cheyumbom fingers ellam kuda twitch aayittu varum. Okay, so that is what it is drawn there, but my drawing is not much good. Okay, so it look like this spasm of the fingers and elbow. Okay, if that shows, yeah, if there is a signs, this particular finding if it is present, it is indicating that patient has hypocalcemia and Trousseau sign is positive. Okay, so this is physical examination steps consider or a physical examination finding. It is very, very important. Okay, so signs of hypocalcemia, it is important. And see, you have to assess the signs of hypocalcemia because all of these signs are considered as a lethal complicatory sign. So you have to identify the signs in advance and then treat. So before treating, you need to know what are the causes, and underlying cause need to be treated first. So we will see what are the reason or causes. Okay, so the causes like electrolyte imbalance and pancreatic disorders, parathyroid disorders or hypoparathyroidism, renal failure and botulinum toxins and decreased magnesium level. I repeat, the first is electrolyte imbalance. Electrolyte imbalance always changes the calcium level in our body, and pancreatic disorders will reduce the calcium absorption. And hypoparathyroidism, it releases or it decreases production of parathormone and it always alters calcium and phosphorus metabolism. And kidney failure, kidney is necessary for activating parathormone. So if kidneys fail, ultimately parathormone activation is decreased. Okay, so that's point. The kidney fail parathormone stimulation that calcium absorption alter. Then botulinum toxins again alters the absorption of calcium. Okay, or metabolism of calcium, and then decreased magnesium level. These are the causes. So how do we manage? The number one management is identify the cause and treat. So initially you need to identify what are the causes, then treat the underlying causes. Okay, and number two, you have to prevent getting complications like respiratory complications and cardiac complications. You need to closely monitor the respiratory rate and cardiac function. So you can attach the patient with a cardiac monitor and you can monitor arrhythmia or ECG, and respiratory assessment, it is very, very important. And even you can keep a tracheostomy set near the patient's bedside when a patient has severe hypocalcemia. And treat the hypocalcemia, that means you can replace calcium. Calcium can be replaced through food or supplement. Calcium can be replaced through the food. Food and calcium rich diet. See, whenever you give calcium as a food, you have to give vitamin D also, because vitamin D is necessary for the metabolism of calcium. Calcium rich diet vitamin D should also provide with calcium. Okay, so identify the cause and treat the cause, and then replace the calcium level or replace the calcium through food or supplements. Okay, and identify the signs and symptoms and manage all symptoms accurately. This is how you can treat tetany. So please remember, tetany is by hypocalcemia. So whenever a patient has hypocalcemia, the patient may develop tetany, is characterized by tingling sensation, numbness, spasm in the extremities, and laryngospasm and breathing difficulty. I hope all of you have understood, and please like the video and subscribe the channel. Thank you for watching. Always stay blessed. Thank you.